5 years ago this month, the world went into lockdown due to the COVID-19 pandemic. And today, aspects of the lockdown continue, fallout continues. And joining us right now is Will Humble, the Arizona Public Health Association, who's going to talk about that. Will, good to have you here. Thanks for joining us. Does it feel like it's been 5 years?
In some ways it does, in some ways it doesn't, you know? Things are a lot different, but in some ways we're living, in a different world than we were 5 years ago.
What is the state of COVID right now?
So still bumping along. In Arizona, we had our seasonal COVID wave back in December, January. The rest of the country had it a little bit later, like last month. So it's a virus that will be with humanity for as long as we're around, I think. But it will continue, I think, to mutate and become more and more contagious, less and less lethal. And of course, there's a lot of antibodies and immunity out there that make it less of a public health crisis or of an infection threat for people.
And yet, at one point, it was public enemy number one. And it seems like long COVID continues to be a concern. How much of a concern?
Well, if you're somebody who has it, it's like a life-changing concern.
Yeah.
But long COVID doesn't mean forever COVID. So of the persons who got a really bad infection, about 10 to 30% of them have weeks to months worth of symptoms, usually neurological, sometimes physiological, issues with endurance. The biggest complaints are really neurological, brain fog, those sorts of things. But it doesn't mean that it lasts forever. And there are some treatments for persons with those kinds of symptoms. Low-dose naltrexone, for example, is one. Just cognitive behavioral therapy to help you deal with it. If there's anxiety and depression, there's medications to help with that. But it does affect people's ability to function in life, which is not easy,
Has it always occurred to those who had a bad case of COVID, or was it something like you had a glancing case of COVID and you never got rid of the symptoms?
Yeah, so yes, people who had a mild case, maybe just loss of taste and smell, can still have for weeks, months, or even years symptoms, but it's predominantly the long-term COVID symptoms last in people who were really hit with it hard and early. Those early versions of the virus were more lethal and harmful to the body. It mutated, which you expect from natural selection. A virus isn't going to be successful if it kills its host. So it needs to keep changing and become more transmissible, less lethal.
But the early infections are the ones most likely with the long COVID. That's interesting. I had not heard that. The lasting effects of the pandemic, and let's speak in societal terms here, just simply the public trust in science and medicine.
I think in the long run, in terms of my experience in public health over the last 30, 40 years, it's been the single biggest event to undermine trust in institutions and science, not just trust in science, not just trust in the scientific method, but really trust in institutions is what has eroded. And I don't know, eventually maybe we'll get some of that back, and not eroded with everybody, but there's 30, 40% of the population that thinks differently than they used to, not because of COVID per se, but because of the way the first Trump administration talked about it.
Well, and also public trust in vaccines.
And that, right. Which it ties into, if you lose trust in the scientific method, in science and evidence-based medicine, you've also lost trust in vaccines and lost trust in the FDA, who's the regulator of the vaccines for safety and efficacy. So maybe we'll get that back someday, but it's been a big hit to the world of science, I think. Not because of COVID per se, but that reaction to it, the political reaction to it.
I was going to say, it seems as though it was bad, it got better, the vaccines made it get a whole lot better, conditions get a whole lot.
Yeah.
What's the problem?
Well, now I'm getting out of science just from what I think.
Just your thoughts. Just your thoughts.
I think there's a lot of people that just really resented the restrictions on what they believed were their liberties, like asking people to wear a mask in a public space, those initial stay-at-home orders, really resentful of the fact that their kids lost those months of learning in school, and it still hangs with them, you know? And so I think that's, more than anything, I think it comes out of that piece, and it's I think, and I'm just going to say this, I think it's mostly among persons who are less concerned with other people than they are about themselves.
With that in mind, we've got about 15, 20 seconds here. Real quickly, are we prepared for another pandemic?
Well, it depends.
Does it depend, though, with that loss of trust in science?
Good question. Like, for example, if we had another H1N1 like we had in
Yes.
2009, 2010, I think I would answer that question. We're better prepared than we were medically, scientifically, vaccine development-wise, and so forth. We're less prepared in terms of, you know, getting people to buy into the public health interventions that are critical to slowing down the spread.
Especially something that they're not familiar with. Will Humble, Arizona Public Health Association. Good information. Good to have you here. All 5 years. You've been on here talking about COVID for 5 years now.
Since you were doing it online.
Since we were homebound, yeah. Good to have you here.
All right.